Today, I'm going to discuss about the association between periodontal disease and preterm birth, which is particularly a cross-section study. This is basically my first collaboration with the Department of Dentistry in our college, and I guess this is about to get published. And I thought further maybe some more collaborative projects we will do further with, particularly with dentistry. Basically, I'm from medical background. So the contents are like we are going to cover these contents like introduction, pathophysiology, periodontal disease, and preterm delivery, materials and methods, results and conclusion. So coming to basic introduction, like periodontal disease, like it is characterized by inflammation and infection caused by harmful bacteria. Typically, it will be gram-negative bacteria, and prevalence is basically increases with age, whatever the data available currently, and due to the factors such as mainly poor oral hygiene, smoking, or hormonal changes that is particularly associated with puberty and pregnancy. And periodontal infection, it is basically linked with several chronic diseases like osteoporosis, diabetes, cardiorespiratory illnesses. Recently, we also sort of planning something related to periodontal disease association, specifically with the cardiovascular diseases or some other diseases related to respiratory illnesses, like either maybe it may be pneumonia or basically periodontal disease. As per current prevalence, it's majorly seen in this pregnant woman, and our study is particularly going to consider that particular topic where in recent days that has been a huge concern in post hospitalization of many patients. So the community periodontal index of treatment needs is an effective screening tool that can indirectly diagnose periodontal disease at its most severe stage, and it has been validated. So basically, this is the index we are going to use in this study. So that is why I mentioned it. And coming to pathophysiology, like particularly as I mentioned, gram-negative bacteria and the byproducts, they can spread different set other parts of body too, and this can lead to develop new set of lesions, which is particularly harmful to various organs and organ systems, potentially leading to some systemic side effects. And coming to the association, what I mentioned in the title. So preterm, that is particularly occurrence of birth before 37 weeks of gestation, which is basically mentioned as either preterm delivery, premature delivery, or it has a lot of names. But preterm birth is leading cause of illness and death during first year of life, and it is estimated that more than or between 19 to 13% of births globally are premature. The association relationship between this premature birth and post-delivery complication is robust, and currently it is too much as medical facilities currently in many countries. However, the urbanization is there, but medical facilities is not that up to the mark. Certainly, either it can be low income countries or low middle income countries. So, due to even extensive urbanization, or the literature or the number of literacy rate or the content of particularly governments taking some projects related to this pregnancy or maybe oral hygiene, that is comparatively less because they're more concentrating on this uh, things which are currently like either it may be some more majorly on infectious diseases, or it may be some seasonal diseases or illness or flus. So indicating this significant avoidable risk can help address pressing issue of premature birth. So coming to periodontal disease and preterm delivery, like this is second slide, the combination of hormonal markers such as like
It's
uh,
okay.
yeah. So aim of the study, let's go to. So to investigate the association between premature delivery or pre-birth and periodontal disease, this is the main aim of the study. So here the design of the study, basically it's observational, descriptive, and cross-sectional design it follows. And 135 postpartum patients, particularly whoever admitted to our hospital between 2021 to 2023. So age range is around 17 to 35 years. A single birth occurring after 24 weeks of pregnancy is the main inclusion criteria here. And we have utilized CPT here. So CPITN, like Community Periodontal Index of Treatment Needs, as earlier I mentioned in the introduction, for assessment of periodontal health state. So clinical records were also considered, and it included a data on the number of weeks of gestation and other obstetrics gynecological information and a data. Socio-demographic and lifestyle information was collected directly from the patients. Data analysis that particularly revealed, like we included like Stata 11.0 version, and we also use logistic regression to examine the association between preterm birth and periodontal disease. So coming to the results, like basically, uh, in the materials and methods too, we have also included a different set of codes which are associated with CPITN, and 58% of the patients had particularly had the codes 3 and 4 according to the CPITN index. These codes indicate the need for complex treatments, including deep scaling, curettage, and surgery, and such as the presence of periodontal disease. Among individuals with periodontal disease, 20% had preterm birth, whereas only 8% of those with minor codes had preterm birth. A positive correlation was found between periodontal disease and age, with those over 30 years of age accounting for 31% of level 4 patients or code 4 patients. No significant correlation was particularly observed in between the smoking behavior, as it is around 32%, but a correlation between periodontal disease and other characteristics, including the likelihood of preterm delivery, was observed. Coming to the odds ratio, particularly as we calculated, the association between uh, preterm birth and periodontal disease is around 4.5, which is statistically significant, with a 95% confidence interval of 2.6 to 9.5. And coming to conclusion, to address preterm births, it is crucial and important to collaborate with obstetrician, gynecologists, and dentists to develop diagnostic treatment and protocols, as this is comparatively pressing issue in terms of this pregnancy-related complications, as not all people particularly concentrate on it, because the main thing during pregnancy, the role of a doctor, it completely depends on the management and a safer delivery. The further complications are not highly neglected, but still there is a difference in between the treatment offered and the management, whatever the done post pregnancy. Because during pregnancy, however, they take too much care and everything goes well, but still some things like periodontal disease or some set of dental issues are basically gets ignored, because they basically concentrate only on childbirth or the mother health. So this thing is also more important, and advocating prenatal care that assesses oral health is essential, because particularly among demographic groups that often overlook it. Because particularly demographically, if you look at it, epidemiologically too, there are a lot of concerns related to this poor oral hygiene, and that is more important. Promoting dental checkups and treatment is also necessary, similar to the campaigns, particularly some countries promoting about folic acid or any other particular drugs. A prospective study with interventions is recommended to determine the most effective measures for preserving both maternal and fetal health, in terms of not only in different set of medical departments, even including the dental health or dental hygiene or oral hygiene too. The study also aimed to educate expectant mothers and healthcare professionals about the benefits of achieving pregnancy with optimal oral health. So basically, the this attempt is clearly about to find the association between different set of diseases or different set of physiological states or different set of physiological process with association with a dental disease. So thank you.